Here we go. Welcome to our February 14th, yes, Valentine's Day Facebook Live. I'm so excited. We are here with Leah. She saw Aura, our Manhattan therapist, and she has agreed to come on and talk to everybody today. So thank you very much, Leah, for joining us today.
Yes, you're welcome. Happy to be here.
And happy Valentine's Day.
Happy Valentine's Day to you as well.
Thank you. I want to let our viewers know that down below as you're watching this, put your comments or questions in that little chat box, and we will answer those as we get towards the end of our session today with Leah. But any questions, whether it's for Leah or myself as a therapist, we're pretty open around here. So, first of all, again, thank you. But second of all, can you kind of just tell all of us what your journey was, why you were looking for something like Clear Passage?
Yeah. So my husband and I have been on a fertility journey for quite some time. Been trying to conceive for about 7 years now with no success and trying lots of different things. We've moved quite a bit over the last 10 years or so for his job. And so because of that, we've seen several different providers, reproductive endocrinologists across the country on our, I believe, the fourth provider now. And each has been good in their own right and has led us down different paths. We've tried a few different treatments. We've done IUI a few times. That has never been successful. We have talked about IVF, but for whatever reason, whether it was timing and in between moves or locations, it never quite seemed to work out for us. On top of that, they were also not really so sure that would be the best option in terms of something that would work for us because my FSH is high, my AMH is low, and I have endometriosis. So at one point in all of this, I believe it was 3 or 4 years ago, in 2019, I had a hysteroscopy and laparoscopy during which they discovered some endometriosis. So throughout all of this time, I've just been trying to do all that I can to kind of maximize fertility outcomes and chances to the extent that anyone can control any of that, if we can use that word. I've been trying to do everything I can. And more recently, I was seeing a reproductive endocrinologist who also specialized in integrative medicine. And I was doing some acupuncture. And that was the person who recommended Clear Passage to me. I was not familiar with it at all. So I was really excited to learn that there was something else that I could maybe be doing. So that's what kind of led me to Clear Passage.
Well, I'm really excited to hear that a fellow practitioner recommended that you didn't just find us on a blind search. So that's really good to hear. Yeah. I'm going to unpack a little bit of what you've talked about before we even get into our next questions. You were talking about IVF. And for those people who are thinking about IVF, and I know you said that's probably wasn't a great fit for you right now, but Clear Passage actually helps with implantation rates for IVF if anybody ever decides they want to go that route. And then as a mother passes her 35th and 40th birthday, we tremendously help a lot with implantation. The other thing is that IVF is extremely expensive, and Clear Passage is literally like a quarter of the cost, if not more. So you talked about endometriosis. Did you experience signs and symptoms of endometriosis, like the painful intercourse or painful menstruations and ovulation and all that stuff?
Yes, I did. But I didn't realize that it was not normal until hindsight. So after I had the surgical procedure and had some ablations, there was sort of less menstrual pain, but I still did have pain with like leaving a tampon in hurt. That was painful after some time. Initial penetration was painful. And so after seeing Aura, though, with Clear Passage, that has, it's like non-existent, completely resolved. Yeah.
That is so exciting.
Yeah.
Something that you also mentioned in your introduction is that you had low FSH and high FSH and low AMH. And we have run research projects, and you can see them on our website, on how we actually change those numbers to become more in line with people who want to become pregnant. So you heard from the acupuncturist, try Clear Passage. You gave us a call. Could you just kind of go through your first couple of phone calls with Clear Passage, what they did, what they asked you to do, all that kind of fun stuff?
Yeah, I believe I sent an email at first and I got a response back right away with a little more information, and then a phone call. I believe her name was Amy, who called, and she was super friendly and helpful and answered any sort of initial questions that I had. And to back up a little bit, I think before Amy called me, I had filled out a few forms online, just kind of history, sort of like an application to see if I was a good fit for Clear Passage. And then I got a phone call saying I would be accepted into the program should I choose to pursue it further. And everyone at the office, I dealt with Amy and Brenda, and they were both very helpful, phenomenally, just great, easy to work with. They made scheduling super easy. They made the payment process super easy. I don't have any negative things to say about that. It was a good experience.
So Amy and Jessica are our patient coordinators, so they're forward facing in the office, just like Leah said, answering any questions that you might have. How is this therapy going to help you? What to expect. Brenda is the administrator, so she takes care of all that front end after scheduling, making sure you have your payments, making sure you're ready to go. But you said something, Leah, that I think we need to also talk about, is that medical history form. That was pretty long, wasn't it?
It was. Yes, it was, especially for someone who has quite an in-depth history.
So we ask all applicants to fill out a medical history form, and that actually gets in front of a licensed physical therapist. So the patient coordinators that you were talking to, Amy and Jessica's the other patient coordinator, takes these medical history forms and then gives it to a physical therapist. And that's where we start looking at, do we need more information? Am I comfortable treating? Is there something here that I want a doctor clearance for, or is there something here that I want more information on? So we don't blindly accept just everybody who wants to come into our program. We really try to make sure our program is a good fit for you and that we could offer help, offer pain relief, offer hope. So I think that medical history form is really, really important part of our process. So thanks for mentioning that.
Yeah, definitely.
So then you decided on New York, Aura. So Aura is a phenomenal therapist, and she has been with Clear Passage a long time, and we jokingly call her the baby maker because she just has lots and lots of successes, as most of us do. But so tell us about Aura and treatment.
Aura was wonderful. Even before treatment started, she actually reached out with a phone call, just to make sure I was, clear on instructions, where to go, and didn't have any other questions or concerns that I needed to discuss before therapy. She kind of went over the history with me, just with a little preliminary phone call the week prior to starting, which was very helpful. And then I can't say enough wonderful things about Aura. She was amazing. Going into the therapy, I really wasn't too sure what to expect. I mean, you kind of read about it and they tell you about it, but what that actually feels like and looks like, I wasn't really too sure. But she immediately put me at ease. She has this great, warm, welcoming smile, and she's super conversational and happy and really easy to talk to. So she was great to work with. I felt comfortable discussing any concerns with her. She also, what I really appreciated, is she explained everything she was doing and the science behind it and the reasons why it worked. There was always logic and explanation to every single thing that she did. And that was super helpful to know, not just somebody's just saying they're going to do something here, but why they're doing it and what she was feeling and what she was looking at, and what we were hoping to accomplish by what she was doing. So that was all really great.
So Aura called you. So each therapist does it a little bit different. I send out a welcome email with the schedule. So everybody just reaches out a little bit differently at the beginning. So question that people always want to know, was it really painful?
It was not. I wouldn't say it was painful.
No, it's not. Yeah, it's kind of surprising, isn't it?
Yeah. I think going into it, I maybe thought it was going to be more painful than it is, because you kind of read about, the handbook and the instructions, and it says to prepare, you might have some soreness or pain, but I wouldn't call it pain. Maybe some mild soreness after, but really no pain ever throughout the whole week. Right. And actually it got better as the week progressed.
Right. Good. And something else we really pride ourselves on is the education that you talk about, that we pull out our anatomy books, we pull out the cycles, the fertility cycle and the menstrual cycles, and we just educate through the entire week. We have 20 hours with you, so we try to get as much information in as we can. So you mentioned very briefly some of the effects that treatment had. So were you surprised by some of the effects? What were some of the effects? What did you find during treatment and after treatment?
Yeah, during treatment, I felt good. Even day of treatment, leaving from the morning session, because it's 2 hours, at least the way Aura did it, was I would see her for 2 hours, then have about an hour break, and then 2 hours in the afternoon. And even when I went to walk for those 2 hours after the morning session, I felt good. Immediately, I guess I almost felt this sort of lightness. I think I did have a lot of tension, as much as she was working in the kind of ovulatory area. I also had some tension in my diaphragm, and she talked about how tissues are all connected, and things that reach each other. And so just with her working in that area, I felt almost like it was easier to breathe. And I wouldn't say I was complaining of breathing difficulties before, but just an added kind of bonus where I felt like I could get maybe more of a deeper breath. It definitely felt looser and not quite as tight, maybe tense throughout. And then the pain, I would say, that I had mentioned earlier, like pain with penetration and being able to like leave a tampon and those types of things, that got better towards the end, probably like by day 3 or 4. That was gone, not resolved, really.
Wonderful. Oh, that's exciting. Did you happen to have and I'm asking a question I don't know the answer to, did you have your hormones checked yet?
I have. So since Aura also recommended the fertility, the reproductive endocrinologist that we're currently seeing now, who is great, and that has been a wealth of a resource from her. And so, yes, that has been checked. It's it's a little bit, my FSH is about the same as it has been, and we're still working. No, she hasn't been the baby maker for me yet, but I'm still holding out hope.
Absolutely. Absolutely.
Yeah.
And you have decreased pain, and we've got the resource of a good fertility doctor.
Absolutely. So. I feel like we're on the right track for sure. It's definitely a step in the positive direction.
So what emotion comes up when you think about Aura and Clear Passage and the entire process that you've been through?
Oh gosh, I would say hope. It's really hope and someone you can, just a place to be able to share it. Infertility can be pretty isolating in the sense that not a lot of people like to talk about the bad side of infertility, which is that not everyone achieves pregnancy, unfortunately. But I think that there are things that we can do and steps in that process to help and maybe make that better along the way. If you can alleviate pain, I mean, that's huge. And Aura, along with the manual therapy techniques that she's doing and teaching me, she also has these great, she has this wonderful painting and takes you on a kind of visualization of a fertility journey and does some great meditation work as well. So it's really not just, the physical, but whole body treatment, whole patient, I guess.
Yes. And I stole from Aura the whole meditation and that journey. Yes. So yep, we're using it.
It's great. It's great.
You also mentioned that we give a home exercise program. So I want to make sure everybody realizes that when you come in for therapy, we just don't send you home and say, okay, you had your 20 hours. Thank you very much. We educate you, but we also give you a home program to do at home to maintain the changes that you received and even hopefully continue to improve on the changes. So you should always be able to take care of yourself in the future. And I think that's a huge part of our therapy between the self-education and the home exercise program. That's a huge part of our therapy. What do you think, Leah?
Yeah, absolutely. And I was a little hesitant throughout therapy that I would really be able to do what she was doing on my own. But she definitely, like you said, provided the education and made me feel comfortable and confident in my ability to do it. Even certain areas that I need to focus on. She had me bring in like just a white t-shirt one day and she drew, markered spots on the t-shirt. So I don't have to guess. I know where I'm going, which is super helpful for me.
That's a great idea. You just taught me something. I love that. So if anybody who's listening wants to ask a question, please go ahead and put it in the chat right now. As we start to finish up, we'll answer your questions. As we finish, Leah, is there any advice that you have for anybody who's listening or who's thinking about Clear Passage?
If you are thinking about Clear Passage at all, I would definitely recommend at least reaching out to them, give them a call, send an email, see if they might be able to benefit you. I know the 20 hours in 1 week can seem a little daunting, but it's definitely, if you can make it work out in your schedule, I would highly recommend it. And surprisingly, those 4 hours each day go by so quickly. At the end of each little kind of hour, they take a little break every hour to kind of do some documentation, or each session, I guess, but it always seemed to fly by. It goes by so quickly. So yeah, I would definitely recommend reaching out, see if there's something that they can do for you. One of the things that I love most about it is that it's natural. And so it can't hurt. And I think you might be surprised at the ways in which it can help. I'll add a little caveat. It can't hurt if they clear you for therapy, right? And say that you're appropriate. But it's certainly, I think you might be surprised at the ways in which it might help. And check with your insurance as well. The office staff was very helpful in providing me with all documentation that I needed to submit to my own insurance for potential reimbursement as well.
Oh, good to know. Thank you.
Yeah.
Good idea. All right. It's not looking like we have comments. I'm going to look down here to say our phone number. If you just want to call in and talk to one of our patient coordinators, which would be Amy or Jessica, our phone number is 352-336-1433. I'm going to say that again, 352-336-1433. Our website is clearpassage, all one word.com. And we have locations in Nevada, Texas, Missouri, Michigan, New York, Gainesville, and London. And that is part of the reason why we do all 20 hours in a week, is because if you're traveling into a location, you don't want to spend the 2 or 3 weeks there. We have done research that shows that 16 hours of therapy, but then the evaluation and the discharge of the home exercise program. So it's the 16 hours plus those extra hours, the 20 hours makes for the most effective program possible. Oh, Leah, it was wonderful to meet you and wonderful to talk to you today.
Thank you. Wonderful to meet you as well. Thanks for having me.
Is there any closing words that you'd like to say?
No, I'm just, I'm grateful to Clear Passage for the tools and hope that it has provided me. And I think, it can never hurt to have more tools in your toolkit. So I'll always keep this in mind, and I'm continue to be hopeful that maybe we'll get some more positive results further down the road.
Good. And I'm so glad you're feeling better already. Thank you so much for your time today.
Thank you.
Have a great day.
You too. Bye-bye.